Good afternoon. Thanks for joining us. I'm Jim Wallace.
And I'm Carla Heath-Sands. Some scientists are predicting a rare brain-eating amoeba to grow because of the record high heat and water temperatures in our area. The Department of Health is sending out a warning after a Georgia resident died from the rare brain infection.
WALB News 10's Alicia Lewis reports on what you need to know before you jump in.
Be aware but not afraid. According to the Department of Public Health, only one Georgia resident has died from the disease so far this year. They tell me this marks the 6th case in Georgia since 1962. The health department says the United States typically generates about 3 cases of the disease a year. The Department of Health is not naming the fresh body of water that the victim was infected by because they say every lake, pond, and river carries the same risk.
More common in the summer months because temperatures are much higher. And this particular organism thrives in very warm water.
Symptoms include severe headache, nausea, and vomiting. The disease is known to progress rapidly that can lead to seizures and a coma. Lowery says the disease is more common in males and in children.
Incubation period, or the time after exposure, is typically 1 to 12 days. More commonly, it's within 5 days. The majority of cases do, unfortunately, end in death. So once symptoms begin, it's pretty rapid progression from no symptoms to pretty severe.
According to the Department of Public Health, if the disease is found in the water, it would enter through your nose. They're advising the community to try to keep your head above water or plug your nose.
If you do anything to agitate it, it can make it come to the surface, especially if you're more inclined to kind of get your head underwater.
The amoeba only affects humans and not animals. Lowery says there is no cure, so the best way to battle this is to avoid it. Alicia Lewis, WALB, your hometown news source.